Hello dear aspirants, welcome you to Sail to MDS Dental Academy. So today here we are with the orientation part 3. In part 2 we have seen about the importance of the abroad dentistry and immediately clinic opening after BDS. In part 1 we have seen the various options, ingredients for your better dental surgeon, then about the dentistry saturated and not. So in part 3 we are dealing with the other decision, to be precise I say that's to do MDS, and the decision 4 that leaving the dentistry and going for other programs. So dear friend, there is a decision number 3 that is to do MDS. So there are a lot of negative perception is there among many of the dental students which have been fed in your mind by your seniors, maybe by batchmates and few of the people surrounding you. So I have jotted down few important points which are important and which many of you have in your mind, and many of students are asking me, which will turn your negative perception into reality. So let's get started with that. So first is experience proportional to earnings. Remember, in MDS, just when you complete the MDS, immediately you are not going to earn, but as your experience will increase, your earning is going to increase in exponential manner. As compared to the other things, your earning will be increased in folds as your experience will increases. Second point, MDS has value, yes or no, and change in MDS scenario. Yes dear friend, MDS has value if you have ability to create it. We'll talk about few MDS scenarios. For example, endodontics before few years people used to learn in the college. As an MDS I am telling, they used to learn the normal root canal therapy, the normal endodontic surgery and few conservative important points. But nowadays if you do the endo in good colleges, you will not only learn root canal therapy, but along with that you will learn the aesthetics like veneers, the preventive crowns like your onlay, inlay, 3/4 crown, which is now part of the dentistry, and you will learn the micro endodontics. You will be the micro endodontics. You will learn the microscope endodontics. So in this way the scenario is changing. Just one more example I am taking is your pediatric dentistry. In previously in pediatric dentistry, the pediatric dentist used to learn the pulpectomy, crown and space maintainer. Nowadays if you go to do pedo, you will not only learn these three things, along with that you will learn the new crowns like zirconia crowns are there in pediatric dentistry. You will learn the preventive orthodontics, interceptive orthodontics, pediatric implants are also there. So you can see how the changes is there in the MDS. One more example for the oral medicine. Previously when you do the oral medicine PG, college job and then clinic. But nowadays many of my oral medicine friends are working in good X-ray centers, because for every dental procedure OPG and CT scan is become the common thing, CBCT we can say. So every center is hiring good trained oral radiologists and they are earning in very good amount. Because people need, now the scenario is changing. So dear friend, MD has value, but you have to keep it and you have to learn properly. Then we'll talk about the most wrong thing in your mind. MDS is very costly to do. Many of students give me example that sir, we have financial problem, so I am not doing MDS and I want to open the clinic. Dear friend, who is telling that MDS, to do MDS is you have to pay? I am not telling you to go to private colleges. Go to the government college. The first month only you will earn the stipend of 50 to 60,000. Your financial problem will solve. Yes, you have the guts to work hard and to be in the top 500 of the NEET MDS. Then easily you can get in GDC and you will earn from first day only. So really MDS is not costly. To do MDS is not at all costly. Then comes this wrong thing, gap of 1 year. Sir, we take a gap, but it's better we'll take a gap of 1 year, we'll prepare. We and many of my students, we prepared in the internship and we got the seat. Internship is the best time to do preparation. Why? First, you are fresher with the knowledge of final year. Second, you have accessibility to the teachers and the library in your college. Third, you will meet your friends. So you will be always freshen up. You will not have any kind of pressure. You will be free, so you can study properly. You have proper ample amount of time to study. But if you take a gap of 1 year, what will happen? You are at home, you will not meet your friends, so you will not get that much freshen up. You have no accessibility to the library and your teachers. Constantly pressure will be there of your parents and adjacent relatives. You will start joining some clinic, you will have less times, as well as if you are not study properly, the learning will go down. So dear friend, please don't take gap of 1 year. Try to start in the internship only. And if you have taken gap of 1 year, no problem. Focus it properly and study. MDS for clinical work, not really correct. Clinical work as well as academic. Yeah, there are opportunities are there in the academics. I'm not telling the college related academics, but the other opportunities are also there for the research purpose. And the importance is that the clinical work which you learn in the MDS have difference. We learn the 3 important aspects of the any treatment, like diagnosis, treatment as well as prognosis, because whatever you are doing in the department, it is mandatory that you have the correct prognosis of the patient, because in exams you have to keep all your cases, and that will always improve your decision ability. Then comes the MDS as abroad chances. Yes, in South Asian countries like UAE, like Abu Dhabi, Saudi Arabia, Dubai, Malaysia, Singapore, you have the good abroad chances. Just you have to clear the license exams. So dear friend, these are few 7 to 8 points I've jotted down. Once again, just will tell, yes, the earning will increase as your experience will increase in MDS. MDS has value. The changing in MDS scenario, remember MDS is not costly to do in government dental college. You need not require a gap of 1 year, and MDS will not only improve your clinical work but also hone you with the academic work also, and MDS has abroad chances. Then dear friends, don't get trapped. When you are going to do the MDS, many of students have seen that they get trapped in something. Bas MDS karna hai. Remember, when you do the MDS, do from good government colleges and good private colleges. Don't do from the private colleges which will not train you as proper MDS, and you will become just your modified BDS, which I tell as modified graduate. If it is there, then you will not get that much power, or you can say you will not be that much successful as the apt MDS, or you can say the trained MDS will be. So try to join college which is better and which will make you proper MDS, not modified graduate. Second, delay your preparation. I have already told, don't give a gap of years, start the internship only. Third is guidance, that is the changing pattern versus the outdated pattern. See dear friend, every year the pattern of need is changing, the pattern of asking question is changing. So when you are taking guidance, please assure that the person from you are taking guidance is updated or not. Even if you are in a internship, you are taking guidance from any of your MDS doing senior, the pattern has been changed. You should know that you should take the proper guidance. Otherwise, if there is wrong guidance, then your work hard will be of no use. Fine. As just example, I say before few years, people used to focus more on repeats, but nowadays the amount of repeat is hardly 5 to 10. So always get updated or take guidance from the teachers who are giving you the updated pattern. And last but not the least is not sticking to your own goals. Your mind, your life is there. So you always stick to your own goals. Your goals should not be affected by your friends, your seniors and the adjacent environment. So friend, please don't get trapped in this. So fourth decision that many of students, because of the wrong thoughts and the wrong perception, they are changing your path and leaving your 5 work hour of the BDS and changing your stream. Fine. So they do mostly by hearing few wrong voices and doubting on their own skill. Before doing, how you know that you are not proper to be the dentist or dental surgeon? So please don't doubt on your own skills. Yeah, if you're not at all liking dentistry, like 100% not liking, then you can change your path. But remember, this hospital management, clinical research, etc., they have the short-term gain. Means you will join, you will earn in good, but long-term your earning will not increase that much as after the dentistry will increase. So please, before changing path, remember they have a short-term gain, not the long-term gain, and always believe it as slightly wrong way. Now, short-term clinical courses. Remember, dear aspirants, they are of useful, but not completely. I have seen many of students are joining their short-term internship courses. I'm not saying they are wrong, but they are not that much helpful. You should understand the principle behind the courses. Remember, the short-term clinical courses is for the upgradation. It is not a degree course. I also used to conduct the short-term courses, and I am also attending short-term courses. The small example I want to give is that before we used to do the mouth breathing appliance. We used to give to the patient mouth breathing appliance. So few days I attained one oral myotherapy course. So by attending that course, I updated myself with a few appliances. So this short-term clinical course is for upgradation. You know the another name for short-term clinical course, that is the continuing dental education. Fine. So please, whenever you are doing this short-term clinical course, you should know it's an upgradation, not a degree. One more example I want to give is that two of my friends are there. They both have joined the orthodontic 1-year course. So one of friend was working in the orthodontist clinic. So she was getting patient every day. So when she has joined the course, she was getting the patient, and in 1 year she was able to learn the good some amount of orthodontics. Why? Because she was getting the patient from the first day. But at the same time, one of my friend who was not getting that much patient and has done 1-year course, he has done 3-4 ortho case and then he has left. So that thing happens in these clinical courses. So always remember before joining these courses, these few important points. Fine. Then we'll talk about what to do. What decision you have to take. I am going to tell you? No, nobody is going to tell you. You only have to take the decision. You should have the proper patience and trust on your God and yourself to take the decision. One small story I want to tell you. Just before few days I have read one book, that's a power of self-discipline. वो book में the author has told, उसने ऐसा बोला है कि हमारे लाइफ में 2 पाथ होते हैं, एक इजी पाथ और एक हार्ड पाथ. हमारे ब्रेन और माइंड को पता है कि हम जब हार्ड पाथ पे जाएंगे सो हमको सक्सेस मिलेगा, और शॉर्ट पाथ में जो इजी पाथ होगा उसमें शॉर्ट टर्म सक्सेस होगा. बट ऑलवेज वी वांट टू गो टू दैट शॉर्ट टर्म पाथ, शॉर्ट टर्म सक्सेस. सो ऑलवेज ट्रेन योरसेल्फ, हैव सेल्फ डिसिप्लिन so that you can go to that hard tough path where you can get the long term success. So the decision or onus is on you that what to select from all these 4 things. Fine. So I want to tell you, congratulate if you have seen all the 3 videos. You have get now idea that what you want to do in the future. So just want to tell few points about my academy, that we have the lectures and the classes for everything, for the AIMS, NEET, PGI, government exams, Army Dental Corps. So any exam you are preparing, you can take my help. Remember, plan it well. We all plan, but never we plan well. That's why I kept 2 different color. You can see for plan it, there is 1 ladder, and well, there is 1 ladder. If these 2 things occur simultaneously, then only you will get success. So one more thing, just compound effect. This is also one of my important story. What that compound effect says that for example, if somebody is giving you in a 1 day 5 lakh rupees, and the second thing is that somebody is telling you that I will give you 1000 rupees every day, and it is going to be multiplied for a period of 30 days. So what you are going to select? Whether that 1 day 5 lakh rupees or after 30 days that crore rupees. Remember, crore rupees. So with the patience, the success comes in your life. So how will you crack any exam with me? Dear friend, I have the fantastic phase of learning. We have the preparatory phase of around 4 to 5 months, in which I will prepare your base subject. And then we have the learning phase, in which again we will revise the subject with the proper combination, which will strengthen your base, and also will update it with the new things. And third, we have the revision phase, in which we will keep on repeating the past 5 years NEET, AIMS, PGI and SRship questions. The detail of this phases will be there in my 4th video. You can watch. So friends, that was all for this last lecture. I hope you have get an idea. Any doubt, anything is there in your mind, you can WhatsApp me, you can message me. For details of my course also, you can WhatsApp, message, email me, you can check.